all the protocols we see today, they were developed over the past 20 months, mostly during a time when we were trying to eradicate the virus from our borders. But now, we are in a very different situation. And these protocols need to be updated for the following reasons. First, it has become confusing and frustrating for most people. If you live with someone at home who came down with COVID-19, you are quarantined, you can't go out, you can't work, students can't take their exams. And once on quarantine, you need a PCR at the start and at the end. And at the end, you have to take public transport to a testing center. Sometimes there's a long queue. And that also added to the anxiety of people. And some preschool centers, for example, or companies, if there is a infected case, it may close down, further disrupting lives of many people. So some people tell me they are more afraid of these rules than COVID-19 itself. And this is a sentiment and a problem that need to be addressed. Second, the characteristic of the Delta variant and vaccinations have changed our risk calculation. With the Delta variant, viral loads tend to be higher than previous variants and rise up very fast. And that is one reason why the Delta variant is a lot more infectious. But there is a slight benefit to that because with higher viral loads, ART, including a self-swab, does a pretty good job at detecting someone who has been infected and is infectious. And that makes ART more useful now than before in terms of detecting COVID-19 patients. Third reason is that given ART is more useful now, there is a potential for us to replace 10-day quarantine for close contacts with a test protocol. Let me share some figures. Currently, about 10% of people under quarantine due to close contacts become infected. Out of that 10%, 8 percentage points are tested positive at the point of starting their quarantine, and 2% tested positive during their quarantine. Given this, a test at the beginning will catch the majority of close contacts who are already positive. And then repeated ART tests can detect most of the rest and the tail risk. A system like that is less watertight than today's quarantine system, but it can significantly and substantively manage the risk.